If your head is like this from reading a book, typing, gaming, sitting, all right, you get that forward head posture. What combines with that is rounded shoulders. I like to teach my patients chin tuck, which is not this. You're not looking down. You always want to keep your eyes straight ahead. So you're straight back, okay? Eyes are straight ahead, and you're tucking that chin straight back. If I took my hand and helped it, it would look like that. What that's doing is helping to renew the natural curvature in your neck. You can do that in standing, you can do it in sitting, you can do it lying down. I always like to have something behind your head so you have some kind of feedback. I see a lot of people that are walking around with their shoulders in their ears. That's because this upper trap muscle is pulling them up. So to stretch these out, you can take one hand, put it behind your back to help lower that shoulder. The other hand comes around like this, and I'm just using the weight of my hand. I'm not cranking on my neck. You want to keep your nose forward. I see a lot of people when I have them do this, they do this. Keep your nose forward so you're directly side bending. You probably see it stretching a bit there. And then you come up. The other muscle, it's your levator scapula. Instead of going directly to sideways, you turn your head and bring your nose towards your armpit. Just like that. It kind of gets right back the back side of the neck. Now if you really want to stretch that, you want to get in the same position with your head. But you take your hand, if your shoulder will allow it, and bring it right back like that. The best stretch is 30 seconds, but the neck is kind of small muscles, a tender area, so I say 10 to 20 seconds. You can also do that in sitting. Instead of putting your hand behind your back, grab the side of your chair. That helps depress your shoulder, and then you can do that stretch as well. There's a deep breathing exercise you can work on because these are tense and tight. If we tighten those tight muscles up even further, we can fatigue. So you can take a deep breath in. As you do that, you squeeze those shoulders up and hold that breath and squeeze as tight as you can, and then you exhale and drop your shoulders. Lowers your blood pressure, lowers your heart rate, improves your feeling of well-being, and helps those shoulders get back down. And working on all these retractor muscles of your shoulders to help get your shoulders back. You take the ends of them and you pull back and then take your hands up. Okay, again, pull your elbows back, squeezing your shoulder blades together, turning your thumbs, and take it back that way. What that's doing is it's trying to combat this forward shoulder posture. So to help stretch that out and allow that TheraBand exercise to help retract your shoulders, you need to have the available motion. You can get inside the door and then just walk forward until your shoulders start getting pulled back. You can't really go any further. To isolate that muscle, your chest towards the ceiling and roll your shoulders back.